A very common inherited disease in Africa particularly. It's more common in Africa than anywhere, maybe in the US because of the black population.
This is a disease which has been there for centuries in Africa, and those who are carriers of the disease, they have protection against malaria. And because that area has a lot of malaria, so sickle, being a carrier for sickle gives you an advantage. You live longer in that malaria infested area. But if you have both parents are sickle minor, or then their child is likely to be a sickle major and likely to have a lot of problems. So what happens in sickle, that about 100 years back the scientists described it for the first time, that how it makes you sick. So it's an abnormal hemoglobin called sickle hemoglobin. There are two chains in the hemoglobin, alpha and beta chains. So in the beta chain there is a genetic defect which leads to abnormal beta chains, and these abnormal beta chains, they lead to sickling. The red cells change their shape into sickle cell whenever there is stress, whenever there is less oxygen, and that leads to cells clogging together and blocking a blood vessel and leading to less oxygen in those areas of brain. You can have a stroke. In the chest, called acute chest syndrome. You can have bone pains. You can have your spleen can be, there is an autosplenectomy. Your spleen, because of less oxygen, dies down, and spleen gives you protection against infections. So when you don't have a spleen, you are a sitting duck for infections. So these children keep on getting repeated infections as well, and they don't grow well. Their hemoglobin stays low because of sickling, so they do need transfusions also sometimes. So this is a disease which leads to very poor quality of life, and if they have stroke in the brain, then they die at a very young age, or they can have paralysis, and that can be lifelong deficit in walking and sitting and other things. Abdul is a very cute little boy. He's about 3 years plus, and he came with his father and mother, and they basically wanted a bone marrow transplant for their child because he was diagnosed with sickle cell disease in their home country.
My child is 3 years old, and we only realized he had this problem when he was about 1 year and a half.
So how the parents describe is that when he was little, say about almost close to 2 years, so he started getting the first symptoms in terms of pain in his finger joints. They were swollen and pain was there in legs and all. And then he started getting repeated episodes of pneumonia, where he would become very breathless and will get high fevers, and X-ray would show that there is an entity known as acute chest syndrome because of sickle cell disease. The blood circulation in the lungs reduces because of sickling, and that leads to this sort of problem.
It is very traumatic, but we were determined that since there is treatment, we will try and get the treatment, and that was why we kept on pursuing options. All the other options, by the doctors explaining that these options has limitations. The only permanent solution is a bone marrow transplant. If you don't do, most children end up dying before puberty. Most of them just after puberty, because their body system cannot take the stress of life that comes thereafter. So if any parent can afford it, I think it is the natural choice to do. There is nothing as traumatic as seeing your own child dying. And bone marrow transplant is not something that you get anywhere easily. So you have to go to an advanced center, maybe a research center. So since then, we've been thinking of where to get him treated. And inquiries were made through Fortis personnel. Just about a year ago, they told us that they can't do it in Bangalore, but there is a new center in Delhi, which is a research center that is coming up. as soon as it's on, they will let us know. So when this hospital started, we were informed that now there is a research center. Then they sent our details to the doctors this way, and they confirmed they can be able to do his bone marrow transplant.
Fortis Memorial Research Hospital in Gurgaon is a high-end facility where such high-end procedures are being offered, like bone marrow transplant. So first thing is that to run a bone marrow transplant program, you need very neat, clean bone marrow transplant facility, because infection is the major risk factor. You need spacious rooms where a patient can stay for about a month in isolation, and 1:1 nursing. Only one nurse sees a patient every time. That nurse doesn't go to other patients' room. And you need a lot of facilities like a good stem cell lab, which we have here, and you need very good blood bank system to provide a lot of blood components. Post-transplant, they need a lot of transfusions, platelets, etc. You need very good laboratory support in terms of doing tests for various infections, because when they get infection, some virus, bacteria, fungus, then you have to have tests which can tell us which infection it is, and we give appropriate treatment. And you need to have a complete team for pediatric care, because these children get a lot of complications. So if they have a complication in the brain, you need a pediatric neurologist, a neurologist who can see children, a pediatric intensive care unit, pediatric gastroenterology. So all these facilities of pediatrics or subspecialty of pediatrics are available in this hospital. So we can provide a comprehensive care for these children who undergo transplant.
We came to Fortis in Gurgaon on the 14th of August. We came in straight, and then we were admitted in the hospital. We spent almost about 4 weeks in the inpatient. When he was being evaluated, I brought his sibling, the mom, and myself. All of us were being evaluated to see who is the best donor.
We have to find a match which is like 10 out of 10 match, a complete match. So there is a test called HLA typing, by which you can come to know whether a bone marrow donor is a complete match or not. So in the family, there was no complete donor available, neither of his siblings nor his parents. But father was 9 out of 10 match, that is 90% matching. So that is an option you can consider where there is no donor available and transplant is required, with certain modification in the bone marrow transplant regimen.
I said, okay, no problem, but we have issues when you are not 100% match. There are a lot of difficulties that are expected post-transplant and all that. So I came back, sat down with the doctors, discussed the details of what are the things to be expected, the negatives, the positives, and all that. And after a lot of explanations, we were satisfied. And then we gave the go-ahead that they should do it.
So the parents were keen that we do this transplant, and they wanted it to be reduced intensity transplant. There are two types of transplant. One is full intensity, where the full dose of chemotherapy is given, and it makes you sick for about a month. You're not eating, you have a lot of ulcers in your mouth, you lose hair, and you are very, very unwell for about a month in the full intensity transplant. And there is a newer transplant called reduced intensity, in which you give lesser chemotherapy but more immunosuppression, so that you can't reject the donor cells, but your own cells also stay for a little while. So you are not getting too many infections, and you are not very sick, you don't get too many ulcers, diarrhea, etc. And you're still fairly well throughout the transplant. So father wanted that we do reduced intensity, and that's what we offered.
And then on 16th of September, the bone marrow transplant was done with my cells as the donor.
And we prepared the child with chemotherapy to finish off his old bone marrow. We gave him a little bit of radiation to finish the old marrow, and then put in the donor bone marrow cells from the father. Under anesthesia, we collected the bone marrow from father. It's about a half an hour procedure, and we put those bone marrow cells as a blood transfusion into the patient. And it took about almost 3 weeks for the new cells to start working. And his hemoglobin started increasing, his platelets and white cells recovered, and he was discharged after a month after transplant. Then the key thing is to know whether these are his own cells or his donor cells. So there are some molecular tests by which we can know whether they are donor cells or not. So we performed a chimerism, molecular chimerism test, which showed that 100% of the cells were father's in his blood now. So his blood system has changed to his father, and he's no more a sickle cell disease patient. He's a normal child like any other, and hopefully should do well over the coming years.
We are happy that he's coming out very, very well. He too can grow like every other child, do all the things that other children do, because a sickler has a lot of limitations. For parents, you see, having a sickle child is troubling enough. If they can't afford it, the only problem is affordability. If any parent can afford it, it's worthwhile doing the bone marrow transplant, because by doing that, you give your child a chance to live.